Hello, I'm Dr. Stephen Blomerth, and you're watching Natural Health Today. This is a show dedicated to your ideas, your questions, problems that you may have with yourself, a loved one, or your family. And what we do is we talk about natural health means for you to help yourself get better. Because I've been in practice for 37 years, and I found that probably 80 to 90% of run-of-the-mill, day-to-day healthcare problems that people usually take to their medical doctor actually don't require drugs, don't require surgery, but can be helped by natural means. And when I say natural means, I think of 4 different avenues to help people. One is manipulation of stuck joints. There are so many different conditions that can feel better and cause a person to get back to normal just by manipulating a joint that's stuck. It can have far-reaching effects, not only for musculoskeletal conditions, but even for other conditions like asthma. And another means of helping people is work on muscles. And when I'm talking about work on muscles, I'm not talking about standard massage. I'm talking about trigger point therapy, where we find knots in muscles, work them out, because there's a network of what we call myofascial or muscle and connective tissue links between your feet all the way up to the top of your head that act like Buckminster Fuller's geodesic dome to knit you all together and to integrate all the different actions that we have to do. And sometimes we have problems we're not even aware of until we come down with pain. And where we have pain is not necessarily the source of our problem. The third avenue of getting people better is exercise. And I'm not talking about the typical exercises one sees when going to the gym, because I've seen far too many people who go to the gym 5, 6, 7 days a week come down with problems. And they say, well, Doc, how come I came down with this? I said, well, you were doing exercises, you just weren't doing the right exercises. And the exercises that you were doing tend to strengthening the muscles that are already strong and not working on muscles that tend to be weak. And the fourth avenue of natural health care is nutrition. Nutrition is probably the most powerful long-term thing that you can do for yourself. And I'm not talking about having a low-fat diet. In fact, usually quite the opposite. But in terms of getting better and staying better, keeping your weight where it should be, nutrition probably outranks all other things that you can do for yourself, and shouldn't cost you a dime above what you would normally spend, because good nutrition doesn't necessarily mean being a vegetarian. It's just being aware of what foods will tend to make you put on weight or get inflamed, and what foods will make you be healthy. So with that in mind, I let people know that you can participate in our show 3 different ways. You can send in your questions via email to pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can send me an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll talk about your problem. We'll read your letter online on our show, and we'll slightly disguise your name so you won't be embarrassed about the particular question that you asked. So with that in mind, let me put on my reading glasses. Let's dig into some of the questions we've had come in since our last episode. Okay, Mary Ann writes in from Middleton. She says, last week I was laying down reading and I got up to answer the phone. I got so lightheaded I had to lean against the wall so I didn't fall over. Since then I've been worried because it's happened a few more times, sometimes even when I get up from just sitting. Do you think I'm about to have a stroke? Mary Ann, I don't think that that's a symptom of a stroke. Let's talk about some common causes of why a person who's either laying down or sitting and getting up might feel lightheaded. Well, if a person is on blood pressure medications and is taking too many blood pressure medications, it can actually lower your blood pressure so low that you'll easily get lightheaded, particularly when you go to stand up, because our body does need to pump blood a little bit harder when we're in a standing position versus sitting down or laying down. And if we get up quickly, like to answer the phone or respond to something in the room, we may not have the time to make that blood pressure elevate quickly enough to pump the blood uphill to our brain. So for a minute, we might have to lean against a chair or a wall to steady ourselves until that dizziness passes. If Marianne isn't taking blood pressure medications, the other thing can be what we call orthostatic hypotension. It's a big, long, needlessly fancy word. But what it means is something is wrong where you can't regulate your blood pressure from one position to the other. And as I said previously, yes, your blood pressure should go up. It should pump a little bit harder when you're sitting than when you're laying down. It should pump hardest still when you're standing up. Even if you're not doing anything, just standing there, your blood has to pump its way uphill to reach your brain, whereas when you're laying down or sitting, it doesn't have to pump quite so hard. And sometimes the reason for that can be, if you're not on a blood pressure medication, just a poor diet. And a poor diet would mean other symptoms that people might have when they have a poor diet long enough to affect their ability to make those changes in their blood pressure from one position to another. Could be lack of sleep. So if you notice that you don't sleep well, and you may also be overweight, if you don't sleep well and you're overweight, and you tend to have a sugary diet, that's a pretty good sign that you might have that fancy thing, that orthostatic hypotension. So Marianne, explore those possibilities. I wouldn't worry about having a stroke given those particular set of symptoms. If you check with your medical doctor, see if you're taking perhaps too much of blood pressure medication. If your blood pressure medication could be cut back, that'd be good. If you can eat a much better diet for several months, it may also go away. If it continues to plague you and you're actually falling down, yes, you should consult with your medical doctor. But I think homemade solutions can be the best if you take your charge of your own health. Try the easy things, the nutritional things first. And Marianne, I hope you feel better on getting up from sitting down and laying down, because I know that kind of feeling can be very alarming. Thanks for that question, Marianne. Stu writes in from Danvers. He says, my hobby is working on old cars from the 1960s. Almost every time I spend a Saturday working on an old engine, my left hand gets so tight from holding onto the wrench that I have a hard time opening it back up again. You have any ideas? And don't tell me to give up my hobby. I'm not going to tell you to give up your hobby, because hobbies are good for people. And so let's talk about why a person who's holding on to a wrench for hours might have a hard time. I think all of us may have been in particular situations where we had to hold on or grip something for a long time. You tend to notice that your hand has a hard time coming back out. So rather than giving that up, I would say, why don't you try a simple solution? And what I brought today is just this is called kinesio tape, or rock tape. And so what I'm simply going to do is take this piece of rock tape and cut it in half. And that way it's about the right width to fit on my fingers. Now, where am I going to put it? I'm going to put it on the back side of my fingers. Okay? And I'm going to put it on so that it stretches out. In other words, it's helping to open my fingers back up. Gripping and closing our fingers on a tool is brought to us courtesy of the most powerful muscles in our hand, which is the flexor muscles, the muscles that close our fingers down. We don't do too many activities that require a lot of strength to open our fingers, so the muscles on this side that close our fingers are stronger. The muscles on this side that open our fingers back up are always weaker. And if Stu is working on a car for several hours on a Saturday and holding a wrench very hard like this, it's very natural that these muscles in here will be in spasm and clenching, and the muscles in the backside, they will be so weak from being inhibited by these muscles that they won't have much strength to open back up. So putting tape on the back of what we call the extensor tendons on each of the extensor areas might help you, Stu, to open back up, because it's very normal for the muscles on here, the flexor muscles, to be much stronger than the extensor muscles. If you give the extensor muscles a little bit of extra strength, and that's what kinesio tape does, it gives the affected muscle a little extra strength by propelling it back open that way. Stu, give that a chance while you're working on your cool cars from the 60s and see if that doesn't help out. It won't cost you much to buy some kinesio tape or some rock tape. Rock tape is the brand name. Kinesio tape is just the general designation. Try some rock tape, put it on the back side of your fingers, on the side that affects the tendons to open them back up, and see if that doesn't help you. Stu, that was a neat question. Let's go on to our next one. Okay, Alice writes in from West Peabody. She says, 3 months ago, my best friend had her hip replaced, and she's feeling so much better now. She thinks I should get mine done too. How come my doctor won't recommend me to get one? Because I get pain in my hip when I walk a lot. I'd like to get back to being active like my friend. Because, okay, so Alice has basically been talking to a friend of hers. Her friend of hers had a hip replacement and it went well, and Alice's friend feels so much better. So that can happen a lot. When you have a particular therapy or procedure done, you may recommend it to your friends. And now Alice is saying, well, why doesn't my doctor recommend the same thing for me? I'm going to stand up for just 1 second and talk about where your hip is, because that can make a big difference. Alice, if you have pain in the backside here, this area I would call your buttock. Even out to the side here, I would still call this your gluteal area. True hip pain is felt more in what people would call their groin, because this is where the hip joint sits. The hip joint sits inside here. So, Alice, if you are having the exact same pain as your friend, it would be in here. If you're having it out to the side or on the back or back down the back of your leg, that is not true hip pain, and that would be the biggest reason why your medical doctor wouldn't be recommending you have a hip replacement therapy, because a hip replacement is good for people who have worn out all their other alternatives and who actually have true pain coming from the hip. True pain coming from the hip, among other things, will be felt in the groin. Now here's the problem. I've had patients who have had total hip replacements and they had the same pain that they had before. Why? Because there are trigger points in the buttock area that can refer pain into the groin, and your sacroiliac joint, which is way on the back side, sometimes it has a characteristic pain referral pattern of going into the groin. So it takes a good hands-on diagnostician to figure out, is the pain actually emanating from the hip, which is felt in the hip, and is the solution for it to replace it, or is the solution for that pain actually going to be found at some other site? There are trigger points that can cause pain referral into that area. The sacroiliac joint can refer pain into that area. So perhaps your doctor is not recommending you to have a hip joint replacement because your pain may not be coming from the hip joint. And I'd say don't rush into any surgery just because your friend had a good outcome. The only time a hip pain has a good outcome is when the surgery was not only done right, but the condition was actually coming from the hip joint and not radiating into the end. Again, many people think that your buttock or the side of your buttock is your hip No, your hip is actually located in your groin. It's not on your butt. So I hope that helps a little bit, Alice. So let's go on to our next question. Okay, George writes in from Danvers. He says, I've been doing plank exercises for a couple of months now, trying to strengthen my abs, but I'm just getting a lot of back pain. I follow along with the online videos, and I do it the way the instructor at the gym says, but it's still hurting me. What do you think about planks? Well, I think a few different things about planks. One thing that I think about planks is that planks are fairly advanced exercise. So George, if you have a background level of health that has not been doing any exercises for many years, then planks are at a level too high for you to start out on. We can't just, it'd be like a marathon runner. Most people know that if you run a marathon, you have worked up to it over years by running longer and longer distances. You don't go from simply walking around the block to running a marathon. You have to build up to it. Same thing about planks. If you have been exercising on a regular basis, doing planks doesn't necessarily mean it's an insurmountable goal. But if you're going from doing nothing to doing planks, planks can be overly hard. So the next thing I think about planks is that most people do an incorrect form of planks. So even if you are fit, you may be doing it wrong. So I'm going to demonstrate in just a minute a better plank that is not going to be generally painful for your back, but it's actually kind of a harder plank and gives you a better workout. So better workout shouldn't hurt your back. Third thing about planks is, even if you're fit, if you have a stuck joint or if you have trigger points in a muscle, even a relatively fit person, planks can give you pain if you have not attended to making sure that the joints in your back all move properly, and there's no way for you to tell yourself. It's like telling whether you have cavities. Yes, you can tell if you have a cavity if you have a huge one just staring you in the face, or if you're drinking something too hot or too cold and it's giving you pain. That's a cavity that's gone a long way. But your dentist has to do a special exam to find out whether you have a cavity. And it involves looking inside your mouth. Sometimes it involves taking an x-ray, because sometimes cavities can only be seen on an x-ray. Similarly, if you have trigger points in your back or stuck joints, you can't tell on yourself. You may have an inkling of a problem, but you don't know. So planks, when you're having an ongoing subtle problem in your back, yes, that can be enough to bring out your pain. I'm not condemning planks across the board, but they are an intermediate to harder level of exercise. If you've gone from doing nothing to trying to do planks, it may be too hard. And even if you're fit, if you haven't had regular care to eliminate those trigger points and stuck joints, even if you're fit, doing the planks can be somewhat bothersome. So with that as a proviso, let me take off my coat. I'm going to get down on the floor and show you how to do what we call the 8-point plank. There's a lot of moving parts to it. I recommend you look up the 8-point plank, because this is something I learned from the foundation training people. It gives your abs one heck of a workout, and that's the thing that I want to stress. Your abs are the thing that should feel the most. If you're feeling much of any effort in your back, if you're feeling any pain in your back, you're not doing it right. And one of the things I'm going to talk to you in a minute when I'm down the floor is, I'm only going to lift my buttocks up off the floor 6 inches, and I might make them go down from there. In this particular plank, your elbows are going to be on the floor, your hands are going to be on the floor, your knees are going to be on the floor, and your feet are going to be on the floor. And that's a critical distinction. Your knees are going to be on the floor. So it looks like, oh, maybe it's a real easy. We used to call it a girl's push-up. Once upon a time, we belittled doing the push-ups on your knees. This particular plank is going to be a little bit harder for you if you do it properly. Your elbows should be slightly wider than your shoulders, and they shouldn't be directly in line. They should be a little bit in front. So your elbows should be a little bit in front of you. You're going to have your hands on the ground. You're going to have your knees on the ground. Your feet are going to be on the ground. And you're going to feel all those things. And when I'm in that position, say like this, I'm going to be squeezing my hands towards one another. I'm going to be squeezing my elbows towards one another. I'm going to be squeezing my knees towards one another. I'm going to be squeezing my feet towards one another. And I'm going to be squeezing my elbows not only in towards one another, but also towards my knees. And my knees are not only going to be squeezing in towards one another, they're going to be squeezing towards my hands. It's a very thorough ab exercise when done right. And if you raise your butt up too high and you feel work in your back or pain in your back, the solution is you lower your buttocks down until that sensation of work or that sensation of pain goes away. You shouldn't have your buttock way up in the air. Your buttock should be lower than your torso. So I'm going to take off my coat. Okay, so this is what the 8-point plank looks like. Okay, my elbows are wider than my shoulders. They're a couple inches in front. My hands are on the floor. My feet are on the floor. My knees are on the floor. And I'm going to pick my head up, but I'm not going to do this. I'm going to pick my head straight up like this. And I'm going to very slowly raise my buttocks up off the floor. Now, while I'm doing this, I'm going to squeeze my hands towards my hands, my elbows towards my elbows, my knees towards my knees, my feet towards my feet. My elbows are going to squeeze towards my knees. My knees are going to squeeze towards my elbows as well. And I'm going to draw everything into the center of my belly button. I'll show you that again. Okay. I'm going to at first pick up my head a little bit. Now I'm pricking up my sternum, and I'm pressing my hands into the ground together, elbows together. And if I find that I'm feeling pain or too much work on my back, I'm just going to lower my buttocks until I feel less. You have to play around with the angle because the angle won't be the same for everybody. But if you've done a standard plank, and if you've done the 8-point plank, you'll find that the 8-point plank gives a heck of a lot more workout to abs than the standard plank. It's not necessarily easier, it's just safer and better on your back. So I advise everybody to learn the 8-point plank and use it only if you can do it without pain. If you can't do it without pain, it says that something is a little bit off in your back, and you need to receive examination and treatment by a qualified chiropractor. Okay, the next question comes in from Jean. Jean writes in from there. She says, I will put my herb garden in on Memorial Day. I know you've mentioned herbs can help your health, though I mainly do it just for cooking. Are there any special herbs that are good for both cooking and for health? There are. There are many herbs that are not only good for cooking, they're good for health. Probably one of my favorites is rosemary. Rosemary is great for cooking. It's also super good for your health. I think a lot of people don't use rosemary too much because if you've ever seen what rosemary looks like, fresh rosemary looks like little pine needles, and it's on these little stalks. And if you just pull them off and try to put it in your food and cooking, yes, those little pine needle things get stuck in your teeth. So this is what I do to help rosemary work out a little bit better. I'll take rosemary and put it in my coffee grinder with a little bit of salt, And then I'll just rip off a bunch of needles, rosemary needles, and put it in the coffee grinder and then grind it up. So I'm immediately going from the fresh rosemary to grinding it up and then putting it on my food. So rosemary is a wonderful thing to grow. It's also great for your health. Another way to use rosemary, I'll take 3 or 4 stalks of rosemary, put it in the bottom of my steamer. In other words, I'm putting it in the water beneath my vegetables. So the rosemary is steamed up, and the essences, the terpenes in rosemary, work their way up through the food that you're steaming, and they not only imply that nice scent, but they also imply all the good of those terpenes that are so healthful for you. Another one is basil. Basil is good for you, and there's several different types of basil. In fact, probably the healthiest type of basil is the one that we know the least. And the type of basil I'm talking about is called holy basil. Holy basil tastes a little bit different than standard basil. It's stronger, and but it has magnificent health effects. Sometimes it's also it's an offshoot of Thai basil. There's a Thai basil that people use in cooking for Thai food. Holy basil has a taste kind of like cloves and a bit like pepper. But it has fantastic medicinal effects. Just remember, it's not going to be the same as sweet basil, so a little bit of it will go a long way. But it's a great thing to plant, to grow, and to use for your cooking, and also great health effects. I'd say oregano too. Fresh oregano has great effects. It's great for your digestive tract as well. And we've come now to the end of our time for this show, so I'd just like to thank you for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and I'd like to invite you to participate, as we did today, with our questions from viewers. And you can send in your own questions to pbdchiropractic@gmail.com, or you can call my office at 978-535-6155, or feel free to send me a handwritten old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll disguise your name a little bit so your friends won't know exactly the questions that you were asking about. We'll talk about natural health care means of you helping yourself get better, because natural health care can eliminate 80 to 90% of day-to-day common health care problems that people usually take to their medical doctor or their surgeon. Most cases, those simple problems don't require drugs or surgery, but can be helped by natural health means. So thanks for watching, and I'll talk to you next time. I'm Dr. Stephen Blomerth, your host. Thanks for watching Natural Health Today. Bye-bye.